Imagine walking into a pharmacy only to find the shelves bare. The sense of dread and helplessness that washes over you is overwhelming. No antibiotics for your child's infection, no insulin for your diabetes, no pain relief for your suffering loved one. The essential medicines that we often take for granted are simply not there. This isn't a scene from a dystopian movie. This is reality for millions around the world. It's a crisis that affects every corner of the globe, from bustling cities to remote villages. Medicine shortages are hitting our healthcare systems hard. Hospitals are struggling to provide even the most basic care. Hospitals are overwhelmed, doctors and nurses are stretched thin, and patients are left in despair. The emotional and physical toll on everyone involved is immense, but why is this happening? What are the underlying causes of this widespread issue? Several factors contribute to these dire shortages. It's a complex web of issues that need to be untangled. Supply chain disruptions, largely due to geopolitical tensions and economic instability, are one cause. These disruptions create bottlenecks that delay the delivery of essential medicines. Natural disasters and pandemics like the COVID-19 crisis expose and exacerbate these vulnerabilities. They highlight just how fragile our supply chains really are. And then there's the issue of pharmaceutical companies prioritizing profits over people, leading to inequitable distribution of essential medicines. This profit-driven approach leaves many without the medications they desperately need. The impact on patients is devastating. Families are torn apart by the lack of access to life-saving treatments. Imagine needing life-saving treatment only to be told it's unavailable. The heartbreak and frustration are unimaginable. The anxiety, the fear, the helplessness. It's unimaginable, yet so many are living this nightmare daily. It's a reality that no one should have to face. Healthcare systems are struggling to cope. The strain on resources and personnel is pushing them to the brink. Doctors and nurses are making impossible decisions, rationing care and using outdated or less effective treatments. These decisions weigh heavily on their consciences. The ripple effects are profound, leading to worsening health outcomes and preventable deaths. But there is hope. There are solutions within our reach. Governments, NGOs, and communities are rallying to find solutions. Collaborative efforts are being made to address this crisis. Strengthening global supply chains, enforcing fair distribution practices, and investing in local manufacturing are steps in the right direction. These measures can help ensure that medicines reach those who need them most. We must raise our voices and demand action. Advocacy and public pressure can drive change. Every person deserves access to the medicines they need. It's a fundamental right that should be upheld for all. It's a human right, not a privilege. We must stand together to protect this right. Join me in this call to action. Your voice can make a difference. Share this message, support organizations working on the ground, and advocate for policies that ensure no one is left behind. Together we can create a more equitable world. Together we can make a difference. We can build a future where everyone has access to the medicines they need. Together we can ensure a future where medicine shortages are a thing of the past. A future where no one suffers due to lack of access to essential medicines. Thank you for watching. Let's work together to make this vision a reality.